What I look for as far as bringing in new team members is one, their expertise in the industry. And if there's no expertise in the industry, what is it that in your career that you can provide that can add value, right? Always adding value. How autonomous are you? Because what this company is a very senior led team. And so you really have to jump in and hit the ground running.
Welcome to Vibecast, the podcast that dives deep into the heartbeat of workplace culture. I'm your host, Kristi Skutvik. Join me in conversations with extraordinary leaders as we unravel their experiences, both positive and negative, that have impacted workplace culture. This podcast is more than storytelling. It's about actionable insights. Are you ready to transform the vibe at your workplace? Let's go. Today, I'm joined by Jasmine Wilson, President and CEO of Moxie Clinical, a boutique clinical research organization helping medical device and biotech companies bring innovative therapies to patients around the world. With nearly 2 decades of experience in clinical research and more than 15 years leading complex clinical trials, Jasmine has worked across everything from early feasibility studies to pivotal FDA trials, supporting groundbreaking technologies in medical devices, pharmaceuticals, and biotech. Before founding Moxie Clinical, she built her expertise with industry leaders, including Abbott, Allergan, and several innovative startup organizations. In this conversation, we talk about what it takes to navigate highly regulated industries, lead with both rigor and agility, and building trust with clients and employees. Please welcome Jasmine Wilson. Jasmine, I am so happy that you're here. I can't say that I've interviewed too many of my current clients. There's been a couple, but I'm really excited to have you. And so thanks for taking the time.
Yeah, and thanks for having me here. It's a pleasure to be here. And yes, I am super thrilled to be here and share all about our vibes in the workplace. So
Amazing, amazing. Well, how I start out every conversation is just understanding your perspective on how you would define a vibe or a vibe in the workplace. So if you wouldn't mind sharing a little bit about that.
yeah, how I would define a vibe in general is just a feeling, whether that's good or bad, and that it basically, for me, is a room or a place that you walk into and it just has some type of energy. Um, and that's in the workplace. I would say our vibe is very, because we've all been working together for so long. Outside of Moxie, I've pulled in a lot of folks that I worked with in the last 20 years. And so it's human, it's friendship, it's peer to peer, colleague to colleague, friend to friend. Um, and I always bring this up because it's such an interesting group and such a pinch me moment every time I think about it. But like I said, everybody that I've brought into this company that is currently either an employee or subcontracting for Moxie has generally been someone that I've worked with like professionally in the last 20 years or has been a referral from one of my colleagues. And so it really is a unique group of people within Moxie because it's curated. And so the vibe is very real, very open, very honest, very supportive. Everyone really just gets in there when you need help. And everyone is pretty much an expert at what they do. So it's a really great vibe in general because we feed off each other and it's a friendly vibe and we like to share our life stories. A lot of us are moms on the team. And so, it's very real and funny and
Yeah.
and all the
Yeah.
good things. Yeah.
And human, right? Like I
Very
sat on your
human.
last town hall and yeah, there was like a humanness to the conversation, even though you were talking about things like the FDA and all these other things that are like heavily regulated and highly controlled. There was a human element like woven in throughout. So, but you bring up a good point that I want to talk about is like this curated team that you have brought in over from working with them or working with people who worked with them over the last 20 years? And I think that's a really important point because one, your team is mostly remote. And so creating that energy and that vibe, in my opinion, is like 100 times harder. That is not backed by science, that 100 times, but it's just you don't get the nonverbal cues of like connection that you do when you're in person. And so, I think for anybody who would say, well, I didn't have the luxury of curating a team, sometimes you don't, right? But if you could kind of pick out the things in the vibe, you said human and, friendly and connected, but, like, what else are you looking for when you bring in people into your organization that are hugely important to Moxie in this remote environment, working with external clients that are highly regulated?
Yeah, that's a really, really good question. So, what I look for as far as bringing in new team members is one, their expertise in the industry. And if there's no expertise in the industry, what is it that in your career that you can provide that can add value, right? Always adding value. How autonomous are you? Because what this company is a very senior led team. And so you really have to jump in and hit the ground running. It's a startup. We're, still building our foundation as Moxie grows and scales. And so you have to come in from day one, hitting the ground runnings. And I have very high expectations. It's a very high quality performing team. And you really have to understand who you're working with and that we are service based. And so knowing that we work with early to late stage companies, med tech companies, and it is a service we're providing. So whether you're working internally from a BizOps perspective, you're still working with external key stakeholders. And so it's really important on the other front to be able to present yourself in a way that you show your expertise, your
Yeah.
authority, and your knowledge.
Yeah. Yeah, no, that's a really great point is like that autonomous piece, right? Because if you have somebody who can't be that, then they start to have all of these feelings about their work, who they are, being disconnected, et cetera, um, that aren't true, but it is what they feel because they don't maybe possess that characteristic. So, and then that consulting approach to the external stakeholders, that is such a different mindset than working internal as an employee, and I know that being in a service-based business too and having a team of people is, it takes some time to get people to start to think that way because it's just different, right? Like, how you respond, when you respond, what you respond, those all look and feel different than when you're an internal employee within an organization just serving internal clients. Yeah. So talk to me a little bit, like take me back in your journey, not a walk through your resume, but just a walk through like how you got to where you're at today and the people who kind of shaped you and defined you, and then any defining moments where you're like vibes and the energy in a workplace are very important. And I want to make sure as I go into this new thing of your own, um, to 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 keep those, maintain those, and build those.
Yeah. Okay, I'll try to be as succinct as possible.
We have a little bit of time, so you can
There
you can go off on a tangent if you want to.
Okay, great. Yeah, it's been a wild journey in the last 20 years. So, just starting off from the beginning of my career, straight out of college, I knew I wanted to get into clinical research just because my family was uh, in the space, in the med tech space, from and biomedical engineers to R&D technicians. And so I basically grew up in the med tech industry, not realizing it until recently that my relatives really had an influence in where I am today. And so straight out of college, I had an opportunity to work for a startup company, and it was in the aesthetics space, and it was to reduce the appearance of wrinkles and rhytids. And straight out of college, it was a startup of 4 people, the CEO, the engineer, the VP of clinical and quality, and, like, their office manager. And I came in, and just wore multiple hats. And, I was only there for about a year, and we were in the middle of preclinical animal study. So I was driving with my manager at the time to these animal labs in Berkeley. I'm here in the Bay Area. And these were long drives. So we had a lot of time to talk. There were moments on the way home where I fell asleep. But she really taught me about different pieces of working within a startup straight out the gate. And it wasn't true clinical research, clinical trials. It was what was happening before clinical trials or preclinical work. And so I learned, how to basically work within a company that needed to build SOPs, document control, the quality system, all of those things, which I think was a great foundation getting into clinical research because a year later, I got into a large corporation with it was global. There were thousands, hundreds of thousands of people, and it was small fish in a big tank. And it was the opposite. And I had a good sized clinical research team, and it was my first time as a clinical research associate. And I was very intimidated. There was a lot to learn. But I will say that having moved from a startup environment to 4 or 5 people to a large corporation, it was definitely a shift of one understanding, like zooming into clinical research straight away, as opposed to like learning the entire business. And so I had a few managers in this large corporation, and it was interesting dynamic because there was a lot of senior folks on my team who formed their own little crew, and then you could tell all the new people were kinda, like, working their way and improving theirself, and that was me, who had no clinical research background, and so throughout my time there, which was about 3.5 years, I really grew into my role as a clinical research associate. I understood the dynamics and how to build a clinical trial, both big and small. But what was interesting about working for that company was even though we were a large company, we were kind of the clinical team was working in a startup environment because we were small and dynamic. Um, and so I had a manager and a director that I reported into, and I remember my director was uh, she was very good at what she did, and she was very particular about the way things were done. And so it came off as I think in hindsight, her intentions were good, and she was teaching us very good structure to the point where she was teaching us how to write paragraphs correctly in our emails.
Oh, wow.
Yeah,
You were
and
getting like an English, a grammar lesson.
yes, yes, because projects slowed down enough to the point where we were trying to keep ourselves busy. And so she really groomed us in how we write our protocols, how we format our documents, how we write our reports. And so I felt like part of that was just education, which was great. But at the time, I felt that it was very much micromanagement because I had to meet with her every day to tell her about what I had to accomplish, everything. And so I was always and always have been a hard worker, and I've always overachieved and overproduced whatever it was I was working on. And so it got to the point where I didn't realize at the time that Sunday scaries were a thing. And I mean this
Tell me about
so
that.
I just remember my husband saying we
You
weren't
now have
married
a
at the
label for
time.
what you were feeling, right?
Yes, yes, I didn't know it was a thing, but Sunday came around and my husband, who was my boyfriend at the time, was like, "Why are you trying to pick a fight with me today? Is it
This
because
is
you have
like a
work?"
great example because it's like the external working world and what you're feeling there, like, translates into your personal life. People are like, "Oh, I can keep it separate." It's like, "Yeah, try it. You go ahead and try." There might be, like, not be a direct link to, like, you do this because of this, but this is a great example.
It really is. I was afraid. I was afraid of her, and I was oh, she believed in me so much, she hired me, and I think because she had a department to run, she was just trying to do the right thing, but the impact it had on me was it was negative, and it was feelings of, "I don't know if I could do this tomorrow. I don't know if I wanna do this tomorrow." And so it turned into this thing where
So
I
did
was
you ever
having
talk to her
anxiety.
about that, or was it like, were you too new in career to be like, "I'm gonna talk to her about that"?
No, I was
No.
too new in career. My direct manager was on maternity leave, so I would tell her, and she understood our director's personality, and sh she would try to make me feel better, but at the end of the day, it wasn't working, and so, I did the best that I could in the time I was there, but I with there was so much travel going on internationally and just living out of the suitcase and then coming back to this environment that is very corporate, um, I just got burned out, and they definitely made me feel very appreciated, 1, but 2, we got acquired by a larger corporation, and so we were feeding into that new corporate structure, and so things started getting taken away. We had to mold ourselves into the new, company, and so the dynamic was changing, and it just wasn't what I wanted, and so I had the opportunity to work with a group of people, a woman who started her own boutique CRO. So she really set the tone for the rest of my career. And she was someone in the cardiovascular space who decided to start her own boutique CRO. And so I had the opportunity to work with two startup companies as a project manager. And it was really a step up in my career in that I was starting to do more trial management. And I really enjoyed working for I learned quickly that I love working for startups. 1, because it's so fast paced, 2, because you're learning so much, and 3, you're trying to keep up and you're doing different things all the time. And so what was nice about these 2 companies, startup companies that I started consulting with, was that they were so genuinely fun and happy, and the environment was much more lax as opposed to the large corporation. And, sitting in weekly meetings with the R&D team, for example, where these guys are just joking around, drinking
Yeah,
their coffee, it just
or
felt
being
like
human, right?
it
Like,
was so human.
yeah,
Yeah.
yeah.
And
Okay, I
so
want you to, like,
yeah.
think about so you said a really interesting thing in how you had all this opportunity to drive to Berkeley with your first leader, right? And that for some people, I wanna go back to that for a minute. For some people could be dreadful. It just depends on the person. So I when I think about, like, leadership and the impact that a leader can have, you look at this corporate leader, and while I'm sure you look back and think, "Gosh, there are so many things I learned and I value from that leader," right? It wasn't all bad, but, like, the way it kind of manifested in the workplace gave you the Sunday scaries. But when you think back to that first leader, what were some of the things like how was she how was what was her approach like that you genuinely enjoyed those drives versus dreading those drives? Because you coulda had the Sunday scaries there too.
Yeah, she was very motherly. And so it was like being in the car with my mom, and it just we talked about life, we talked about what was on the agenda, and she really just took me under her wing and just at whatever stage we were at, she was just really giving me the opportunity to see what we were doing, to be involved with what that we were I was literally holding a clipboard with a worksheet collecting time, like, with a timer while they were, like, working on this animal. Yeah, and so it was an interesting, um, opportunity that I had, and just her dynamic with the VP of R&D, like, there was some tension there that I could see was building over time, and, but what I learned from her is that you could you literally have the opportunity to work on different things. It isn't so linear, right? You just have to go with what the next steps are or where the next priorities are. And I think having her as one of my first bosses out of college, she really taught me that you can wear multiple hats. You don't have to be clinical. You could be quality too. You can be R&D. You can go to different departments. You don't have to just isolate yourself.
Yeah, yeah, that's so true. Okay, so then you went to this corporate environment that and corporate environments can be, I won't say all of them, but can be very linear, right? Of like you have this job and this is the process that you do and you don't move beyond that. In fact, I was just having a conversation with a friend the other day who works for a very, very, very large corporation and she's super creative and she has all these ideas and she started to kind of do this side thing and they came back and they were like, "What are you doing?" Instead of being like, "Hey, you have these other interests, like let's bring that into the organization." They wanted to like put the kibosh on it. And I'm not saying that every large corporation is like that, but they have to have, like, more parameters in order to keep order, right? So I think that's what it is. Okay, so you go back to this, smaller organization or more of a startup environment, and you're thriving there, and that's where you really learn, like, the consulting piece of it, right?
Exactly, yeah. So I'm working for 2 different startups, and they're literally in the same building. One's upstairs and one's downstairs. So it was super, um, like, easy for me to, like, toggle back and forth between the 2 clients. Um, and during my time with the 2 clients, one of them I had to travel to Australia for, which was really great. I got to travel with the CEO, again, a team of 4. And so they were running a trial in Australia. I went with him to go help check the data and ensure that the trial was running smoothly, and really had the opportunity to work with a CRO that they hired within Australia, which in hindsight was interesting because now that we have, Moxie moving forward, fast forward to Moxie, we are based here in the US, but we also have a subsidiary in Australia doing trials in Australia as well. So that was my first time ever experiencing how we conduct trials in Australia. And then the other company, we were doing an IDE pivotal trial. So it was a big, large trial. They were targeting market clearance within the US, and it was a cardiovascular company. So we got to travel to Germany, to a few other places outside of the US. And so I was having so much fun being able to travel to different countries with my R&D engineers. Um, and with the CEO, the founder of one of my other companies. And I think because coming in as a consultant or a contractor and these companies really leaning into me as a person with my expertise, that's where I realized like I really thrive in these situations where I'm given the opportunity to figure it out, and really run from it. And that's where I realized this is what I enjoy. This is what I love doing. And so I spent, I think 2 or 3 years doing that, and, for whatever reason, another opportunity came in, again, for the same large corporation, but a different therapeutic area. Yes, because this company, same company, just acquired a cardiovascular company in the Bay Area, and they were looking for someone to join their team, and it was, project management opportunity, and so I was like, "Oh, I know this company. Yeah, I'll jump in." They were in the middle of, the acquisition piece, like, kinda merging within the large corporation, and so I knew some of the players in the clinical team, and I was like, "Okay, I'm willing to come back," because I actually worked for them when they were a startup when I was in college because my aunt was an R&D technician there. She helped develop the product, and she brought me in to do some data entry while I was in college.
Wow,
Yeah.
how cool.
So, long story short, that company that was transitioning into the large corporation was, I would say, not so much of a positive experience just because the group was bigger, it was growing, they were trying to distinguish different parts of the clinical team. And so I felt like there was definitely silos within clinical.
Mm.
Um,
And what impact did that have? So I think that's really
yeah,
important to note because you hear that term a lot, but it's like, okay, is that good or bad, and what does it actually mean? Like, and compared to what? Like, what else could it be, and how do you make that happen, right? Because I think that's
yeah,
something that a lot of organizations struggle with, but don't know what to do about it.
yeah, yeah. So I being on neutral ground, seeing like the three different groups within that clinical group, I was able to lightly toggle back and forth between the groups and not feed in. I tried my best not to feed into the animosity and the just this negative tension that was amongst the group. And I think, the leadership team was very smart. They knew what they're doing, but I don't think they realized the human side of things. And I don't think they realized what they were saying to the rest of the team was demeaning and it was toxic. And it didn't make the rest of the team that was actually doing the work feel good. And so my takeaway from that position and that environment was that your team is everything. That'll make or break who you are as a team, as a company, and it starts at the top. And if there's toxicity at the top and it's going down, you're not gonna retain, you're not gonna keep the right team members, and there will continue to be this big, just constant issues and
Yeah.
battles that are
Did you ever
unnecessary.
see somebody who had like, in that environment I always wonder about this, somebody who had, like, so much potential, but they were just so disenchanted with what was happening from a toxicity standpoint, right? And that's a big word, so that could mean a lot of things, but, like, they were so disenchanted with the leadership team that they just said, "I'm just gonna put in my time and do the least," like a quiet quitter, right, is what I guess modern day term somebody would call it. And they just like, what did that look like? Like, that toxicity, what did that look like amongst the team? Like, how did it show up?
It showed up in ways where those who were affected were quietly talking amongst their peers about it, and I was one of them, where I actually got to hear firsthand, like, what they were being told to do and how to why they're lacking in their performance and, like, how they should know this, but they don't know this, and so now they're going through training, and it was, I think, down to the when drilling down to the human level, it just wasn't a it didn't, like you said, doesn't make someone feel good, doesn't make someone
Yeah,
wanna try, and it feels
yeah.
like when you're under constant scrutiny and you're getting that level of feedback, which is not positive, it just, I mean, the person eventually left, and I eventually left because it wasn't healthy for me. Like, physically, I was starting to feel certain things, and it was debilitating my stress levels. So, yeah, I was there for, I think, a couple of years or not too long, like about over almost 2 years. And, um, an opportunity came along in a startup space again, and it was another trial management position. And this was one of my favorite companies to work for. Talk
Mm.
about
And why?
vibe.
Okay, tell me. Tell me all the things. Why?
Yeah, so it was a startup. The founder, what it was his very first startup. Um, and he came from um, this great accelerator program in the Bay Area. And he was building and hiring a team, a culture, a vibe of, does this team fit? Are these the right individuals to fit within my startup? And he first started with the foundational layer of, like, the VP of clinical, VP of quality, like all the people who could hire underneath. And so um I ended up finding this through a recruiter, And, I went through multiple rounds of interviews and I finally got the opportunity, and when I joined, at first, honestly, I felt like I was out of my league. I had some major imposter syndrome because
Oh, why is that?
I was surrounded by really smart people from Ivy League schools, and
Okay, how did you know they were Ivy League? Is it because they told you or because
yes,
Oh, okay.
yes,
Okay.
yeah, it was shared,
Okay.
and it was known, and so I think it was just me in general. Like, I was all the companies I worked for, like, I've not been in such a great group of individuals with such, like, rich, you know, backgrounds in school and stuff, and so I really felt like even though I've had so much experience already that, again, it was a startup, and so I just felt like I had to prove myself because I didn't have that Ivy League background, and so I think that's the piece where I was the most insecure. But I had one of the best, most positive, um, managers, bosses. He was the VP of clinical at the time, and no matter how hard things got, or no matter what the situation was that was sticky or difficult, he was such a positive person, and he always saw the light in everything. And I'm over here like, I'm not worthy. And so he obviously saw something in me and brought me part of, to be part of this group, and just cross functionally within the team. It was a young group. And it was so fun. They played pranks on each other. There was literally like a giant, um, what is that character from, Despicable Me? Like hanging from the ceiling of the VP of Quality's office. Like, they would just do
Yeah.
the silliest things,
So
but
they,
it
like,
would
didn't
bring
take
joy.
themselves too seriously either. They're like
No.
these Ivy League bred,
Intellect.
if you
Yeah,
will,
yeah.
right? And, but yet, like, could be, again, human and have a good time and know that, like, laughter probably and fun bring out great things in people.
Yeah,
Like,
we
don't take
had the
yourself too
best.
seriously.
Yeah, serious, and that's what he had to remind me is, like, "Don't take yourself too seriously, have fun, and just do the best you can," and,
And I think
from
people actually appreciate that because everyone goes into a conversation thinking, like, probably slightly insecure, thinking like, "Oh, what are they gonna think of me?" Or what are they gonna, you know, like, are they thinking they're better than me? Are they thinking I'm not serious enough? I'm too serious? Like, there's all these things running in your head, and when you just, like, go in and get to be you and get to be funny and have a good time, like, everyone can let their hair down and, like, "Okay, I don't have to pretend to be something here. I can just be me."
Yeah, exactly, and that's exactly what that environment and that culture was, is be you, bring your best to the table, and it's okay to make mistakes. We make mistakes all the time, and it was never a demeaning, it never was toxic. It was very supportive, very collaborative, and very much like, we can do this together, and also let's sprinkle in some fun stuff here. And I think the person who held it together so well and made a fun dynamic, she was like the office manager kind of overseeing the company, and she picked good offsites, good restaurants. She was always feeding us. There was always food in the fridge. It was just straight up like you were working in a small Google, I guess. Like, it was just there was everything. You had everything you needed. And they supported you because they knew there was going to be long hours. And so um that vibe, that culture is something that I try to instill in my company. Just remembering the feeling, remembering the humanness, the kindness, the funness, the collaborative team effort, and also the food. The food is important. Like, anyone that knows me is like, it's very Filipino. Like, did you eat? Do you want something to eat? I have like this whole shelf of food.
Well, and you're also, like, side hustle chef, right?
Yes, yes,
So you're like, "Okay, well, I don't have that, but I could whip it up for you real
yeah.
quick."
Yeah, exactly. And so that's I think, because of the pandemic and because a lot of it is remote now, it's really that's really what I miss, and I'm trying to bring that back in terms of having people in the office once a month during our team meetings or, finding people who can actually come in a couple times a week because I really miss that connection, and it's so different when we're meeting in person, and so what I wanna say is for that particular startup, that is everything I want to bring and try to bring to my company is that level of humanness and fun, and it's okay to mess up, and it's okay to ask for help.
Yeah.
Um
So there's this tension, especially in a service-based business, I will say, or maybe that's just because I'm in one too, and so that's what I know, but there's this tension, and I won't call it balance because I don't believe in balance, of, like, being serious and supporting your clients and doing good work and not making a mistake because, like, the contract could be on the line or it could be a really costly mistake. And then also, like, supporting mistakes and being human, and so it's like this tension. So how do you do that? Or, like, is there any secret sauce that you have that says, like, "This is how I make sure we can manage that tension because it can be hard, right? Of, like, or you get feedback from a client and you're like, "But this is a really great person, maybe going through a really hard time," but you're not gonna necessarily tell the client that, but, like, how do you in a service-based business, like, how have you been able to do that?
Yeah, with a lot of grace. With a lot of grace. No, so it really, it's unique situation to each client, but what I will say in terms of secret sauce, again, it goes back to human connection. And so I try my best to look ahead and try to de-risk situations. Sometimes it works. Most of the time it works, sometimes it doesn't. And when it doesn't, when something falls through the cracks or we make a mistake, we own up to it right away. We bring it up and we come with solutions to it, right? And so one is owning it, two is understanding what happened, three is creating solutions to it, and four is like actually executing and putting that trust back in because when things go wrong, you lose some trust. And so really keeping that at the top of mind, right, is you can trust us. Yes, we made this mistake, but we're owning it. And here's what we're doing to rectify it. And so I think that's important, not in just even the service based dynamic, but in any, situation or relationship is understanding the issue, owning it, and really figuring out how to move forward and prevent it again
Yeah.
from
Well, and
happening
just
again.
because I get the pleasure of working with you, I also know your style, right? As a leader and a founder is like there are no secrets either, right? So if you're feeling a certain way or experiencing or observing something with somebody on your team or with a client, you are very open to going and having that, like, critical conversation and that I'll call it uncomfortable, right? Like, nobody really wants to do that. Nobody wakes up in the day and is like, "I wanna go have a hard conversation." Like, that is just like I don't know. I mean, maybe some people, but I really doubt it. I've worked with a lot of CEOs, a lot of founders, a lot of leaders, and there's not one person that I've worked with that's like, yeah, I'm just gonna go have a day of hard conversations, and it's gonna be great." But you really step into that gap, and I think that one is, like, very human and also creates a ton of trust with people. Even though it's hard to hear, it's like, "Here's what I'm seeing, observing," and it's timely, so people don't walk away having a feeling of, like, "Oh, she's been feeling this way about me, and she just has been keeping it to herself or talking to somebody else about it," right? It's like, "No, she brought it directly to me. We get to talk through it and find a solution together." And sometimes that means exiting the organization. Sometimes that means finding a new role in the organization. Sometimes that means moving clients within the organization. But I will say, Jasmine, incredibly skilled at that. Um, Not because you want to be, because I think, you have to be in order to build the vibe and the culture within the organization from all of that experience that you had of, like, bringing that all together in a blender and incorporating it into Moxie. So, give yourself some
Thank
credit for that one too.
Thank you. I love that. And I think, yeah, I just have to say it comes with the territory. And the more you do it, it's like muscle memory, right? You start to get better at it. And no, I don't want to have these
Yeah,
conversations, but
and it
I
never
have
gets easier, like, it really doesn't, but it's always the right thing to do. It is building the muscle to have the courage to do it, right? Like, I think that's where it's so hard, is like, oh, I don't wanna do this. I have leaders who are like, they just completely avoid it, and then it pops up in different ways, and you're like, "Well, why is that happening? Why is that happening?" It's like, "Just have the conversation."
yeah.
Yeah.
I
Just
like to
do
nip
it,
it in the
man.
bud. Just nip it
Yeah.
in the bud. Yeah.
Yeah. Yeah, definitely. Okay, so if there is one thing, so now you have created your own organization, right? This CRO organization, and I wanna touch on just for a couple minutes, like, you are doing things differently, which is creating an impact in the client organizations that you support, an impact on people who have had, you know, clinical research experience in the past, and you're kind of changing the way you go about doing this. So, talk to me in, like, very high level, like, what you're doing to quote unquote disrupt the industry and why you're doing it and the value that that brings, because I think that's really important on Vibe.
Absolutely. Yeah. So, what we're doing differently as a boutique CRO, and just kind of looking back in the past, traditional CROs and clinical research in general, it was is and has always been very paper based, right? And so things generally when you're doing paper, things go a lot slower. Um, Fast forward to the pandemic where we had no choice but to do things digitally. And we had to figure out how to conduct our business in a way that was remote. And so thinking about the pandemic and how we went digital and everything was remote, it gave me the opportunity to, one in my career and leading up to Moxie, think, yes, this is possible. We've done it. We're doing it. Why don't we keep moving forward with being digital first when we run our trials? Why is everything taking this long? And why are we utilizing multiple platforms, SaaS platforms, to run our trial? And there's 10 to 20 different logins for any given piece of the study. And so the idea behind Moxie was and being a disruptor is being one of the digital first CROs and adopting solutions that just accelerate our trials and does it in a way that really makes sense from an automation standpoint, from an AI enhancement standpoint, and really understanding what in every workflow of running a clinical trial can we consolidate and automate because there's so much redundancy in what we do. And so we're all about running trials thoughtfully, efficiently, with high quality, and ensuring that we can get you to market faster in a
Yeah.
much more smarter way.
Amazing. And that has, like, an
Yeah.
impact on the world
On the world, on
externally,
global
right?
trials.
Like,
Yeah.
yeah, because of the work that you're doing and on the people who are doing it. And I have to imagine there's a level of frustration when things are moving really slow in an organization. So that doesn't help with, like, the culture and the vibe either, of, like, frustration of slowness. So people have the ability to kind of move faster, see their work hit the market faster. And so it's quite an impact.
Yeah,
Really
it's an
cool.
impact on, like, just the patient, the sponsor creating that
Yeah.
technology, us actually delivering
Yeah.
the
Oh, yeah, the
trial, and
patient too. I didn't even think about that. Yeah.
yeah, it gets to the patient much faster and everybody wins. And so we're trying to solve this giant problem that we have in that things are just slower than they need to be. And if we can get to market faster, we can get to the patient faster and the outcomes will be better. And so we're trying to just create a solution for every key stakeholder when running a trial and through the product life cycle.
Amazing.
Huge.
Okay, so what if there's somebody listening to this, kind of taking all your wisdom and experience that you've had, and now creating your own environment within Moxie, what is like one piece of advice you would give somebody that they can go do now to start impacting positively impacting the vibe within their organization? Because and that doesn't cost a lot of money, doesn't require a whole bunch of approvals. They might work within a large organization and say, there's no way I could do any of this. But like, is there one thing that you're like, hey, just start here and
Mhm.
see where it goes?
Yeah. I think, wherever you are within your company, wherever you sit, you can always create community. Create a lunch and learn, create a Friday happy hour, create a wellness hour, whatever it is that you feel like what you feel makes you feel good that you want to share with other people. Create a club, create an hour, carve an hour out of the week to connect because I think that's where people thrive the most is when they feel connected.
Yes. Yeah. Oh, I was at church on Sunday and they were talking about the loneliness rate is like so high right now. And one would think, like, oh, we're so connected. Why do we feel so lonely? And then it's leading to all these other like things like physical and mental health issues that are just like becoming an epidemic. It's wild because we're not connecting because even dating apps. They're online, right? They're not people are not connecting in person and it's really really detrimental to um all the things for a healthy life. It's wild, but the loneliness rate or people feeling disconnected is like significantly higher than it was maybe 10 years ago.
I believe it. Everything is just so right? Instant, where you get it because you're on the phone all the time. Everybody's on their phone that there's no human connection. And I actually was because everyone's remote, I feel lonely too. And so I'm like, maybe I should start a hiking club every Friday at 11 a.m. And I'm just going to invite whoever's here and we're going to go hike for an hour because I love to be in nature. I love the human connection, and so that is something I'm gonna do because I at times feel alone, and so I think it's important to build that human connection, whether it's monthly, once a week, or whatever the cadence is, because it's so easy to feel isolated in a remote setting.
Mhm.
Yeah,
Mhm. No, I love that. I think that's so great. And that will like transcend to your personal life too, right? Like there is there is no boundary, I would say, anymore of like personal and professional life. It the feelings that you have, the way the state of your mind moves between both at any point in the day. So get out there and do something good for all. So awesome. Well, thank you, thank you, thank you for taking the time. Maybe you're gonna go out and hike now or
I'm
soon?
actually I'm going for a swim this afternoon because it's heating
Amazing,
up. Yeah, and so yeah, we're trying to be by the water. The theme is be by the water this
amazing.
weekend.
I'm
And so
I'm with you for that. That sounds great.
yeah, finds what find what's fun and gives you peace. So thank you for having me. This was amazing.
So fun, and it's really fun to have to because I get to experience you in your element of what you're creating. It's really cool to, like, hear the journey that brought you there, so thank you.
Thank you.
From long drives to animal labs early in her career, to experiencing both inspiring and toxic workplace environments, Jasmine has intentionally taken the best lessons and built them into Moxie. Her approach is simple: hire great people, trust them, treat them like humans, and never lose sight of the relationships that make the work possible. I loved her reminder that connection doesn't require permission. You don't need to be the CEO to impact the vibe. You can start a lunch group, create a learning circle, organize a hike, just make space for people to be people. The strongest cultures are built on connection. And in Jasmine's world, that connection doesn't just improve the employee experience, It helps innovative treatments reach patients faster, creating impact far beyond the walls of any organization. Quite amazing. So stay curious, stay courageous, and keep vibing, my friends. If this episode inspired you and you want to see how you can take the next step to creating a better vibe within your organization, I'd love for you to download our complimentary 75 Vibes worksheet. This is a simple tool to create a habit and mindset around creating great vibes in work and life. The best part, it's simple and it works.